A number of my patients, when they see cosmetic surgery, tell me that basically they felt that people treat them as being tired, angry, or sad, while inside they feel perfectly fine. So I think the main reason why you choose cosmetic surgery is to try to correct that imbalance between what people perceive, or even what you perceive, and what you truly feel. Well, one of the main purpose of the consultation is to determine, number one, what your goals are, and number two, what the surgeon sees in you. And the main goal of everyone seeking cosmetic surgery is to reestablish harmony in a face. So as a professional and a person that's done a few thousand cases, I think at this stage I can see exactly what a face requires to produce better harmony. And I've had examples of people who came back to me with thinking they have a nose that's too large, and it could have been, for instance, a chin that was too small. Sometimes as we do look at somebody's face and you say, well, you know, the neck is sagging and so on, we miss the cheek that's drooping or the brow that's drooping. The plan of facial rejuvenation needs to incorporate all of that. And I think one of the ways to truly demonstrate that is through computer imaging. You can take somebody's face and demonstrate by segmental analysis of the face what need there is to improve this face harmoniously. It could be sometimes injectable, it could be skin correction, it could be bone correction, it could be fat injection. I mean, so the variety of procedures are available to improve the facial harmony, and it's the role of the professional to determine that along with the patient, essentially. Well, as an example of what I would call is a rather harmonious and more complete facial rejuvenation, I can show you the case of this young lady here. She was 47 or 48-year-old when she came to see me. And she's an attractive woman. You can see that she has very nice feature, nice neck naturally, very nice nose and eyes. But the overall impression of her face is that she looked tired. She might look a little bit angry, or somewhat a little bit less healthy, you would assume, by looking at her physically, basically. So what we did some computer imaging on her, and we could show her that, you know, basically the cheek needs to be improved by uplifting it, the neck could be improved by tightening it, the lip can be improved by augmenting it, the brow can be improved, and the eyes can be improved by giving a more exotic or more glamorous look to it. I think the overall impression is that, especially when you see the post-op picture here, that she has a much more glamorous look. You want to talk to her, you know, look at her eyes. While before you tend to shy away from it because, you know, her eyes do not express the same type of outlook than she has after a surgery. And I think you see that very often in a well-made facial rejuvenation. You see a new glow, a new approach to people's interaction, and I think it's quite rewarding and great. A very common question by a prospective patient is, are they candidates for surgery, or are they candidates for injectable or more minor or medical type of procedure? It's true that for most people it's a bit of a mystery because they cannot appreciate really what one does versus the other one. If you want to look fresher and you see that the person has a very, very sad expression, obviously the correction of the sad expression is not going to be achieved by a little injectable Restylane in the lips or nasolabial fold or other area. Then you have to resort to procedures that are a bit more invasive, i.e. a brow lift, for instance, or cheek lift, or enhancement of the lips. So when the person comes with a more limited issue, or has already had, for instance, a facelift or cheek lift or brow lift, and you see that she has a deep frown line because there's a lot of muscle activity left between the brow, or some wrinkle around the lip, I think injectable are a perfectly appropriate answer to her problem. During your initial consultation, you'll be able to see a number of before and after results. They apply to a great variety of age, different type of feature, different part of the body, etc. We'll also undergo computer imaging, so that applies more specifically to your specific problem, at which time we can show you what your potential is. So as you look at before and after, always keep in mind the same picture doesn't apply to everyone. Sometimes a patient will bring me a picture of a nose and such actress and say, but this is not at all your type of face, is not at all your type of bony structure. Therefore, you should probably look more at the imaging and see what I think can be optimize in your nose instead of looking at some magazine picture. My best word of advice was first seek the advice of an experienced plastic surgeon. I talk about probably a board-certified plastic surgeon, which has a lot of experience or should have a lot of experience in the type of procedure you're seeking, number one, is capable to demonstrate his philosophy and his view of the treatment that you're planning to undergo on maybe a computer imager. And for you to also see a number of before and after, ask him the right question, like the number of cases done in the past, speak to ex-patients that have the same type of problem, maybe the same age group, and also ask him plainly, is it worth the risk? I think any plastic surgeon should be able to balance risk and returns.